Ganglions are swellings that occur in the wrist or hand. These are quite common and occur at some typical sites, either at the wrist, on the back or the front of the wrist, in the palm of the hand, and sometimes in the ends of the fingers over the back. Ganglions are essentially outpouchings of joints or the linings of our tendons, the so-called flexor sheaths. They are filled with synovial fluid, which is the lubricating fluid in our body that lubricates our joints and also the tendons in the flexor sheaths. They're usually secondary to a small weakness in the joint surface or in the ligaments supporting the joint. Ganglions are quite obvious and often become uncomfortable, and they're not usually very painful, but this certainly can be a symptom sometimes. They are investigated with ultrasound most frequently, and at the time of ultrasound sometimes they can be aspirated, which is where the fluid is drawn out of the ganglion, and then some steroid is injected into the ganglion. This does have a chance of completely relieving the ganglion so that it does not cause any problems in the future. More frequently, this gives temporary relief, and at some point in the future the ganglion comes back. Ultimately, if the ganglion continues to cause problems, then surgery is the best solution. Surgery is relatively straightforward, but does require an anaesthetic, which can be sometimes under local anaesthetic, but usually a general anaesthetic, and is performed as day surgery. An incision is made over the top of the ganglion swelling, and this is dissected away from the surrounding tissues and down onto the joint from which the ganglion is arising, or the flexor sheath. The ganglion is thus taken away from the joint, and care is taken to make sure that the origin of the ganglion is cleanly taken away so that the chances of the ganglion coming back are diminished. Recovery is usually relatively straightforward, and sometimes a splint is used, but often a bulky bandage only, and limitation of activities anything from 2 weeks up to about 6 weeks.